Dr. Chris Shaver here at the GI Show. Hope you are doing well, and we're glad to have you for what I think is going to be a really, hopefully, educational, informative episode on GERD, G-E-R-D, gastroesophageal reflux disease. So we're going to be talking about that today. Remember, the GI Show brings GI to the masses. It's designed to inform and educate you about common and sometimes not so common diseases of the gastrointestinal tract. So I've got a special guest for us today, Dr. Raj Parikh. He's going to be with us. I've known Raj for a long time. He is a board certified gastroenterologist and a good friend. We've practiced together for a long time. Now we are here, I'll bring him on in just a second and we'll talk and we'll get to know Dr. Parikh. We are here today at the lovely BGA Studios and brought to you by Birmingham Gastroenterology. Check them out, including more information on reflux disease at bgapc.com. If you're watching this on YouTube, subscribe to the GI Show and like us. We'd love to answer any questions you have too. You can follow us on Twitter at the GI Show at ShaverCP. So Dr. Parikh, please join me, good sir.
Thanks for having me, Chris.
Good to see you, and welcome to your premiere time on the GI Show. We're glad to have you, and welcome.
Appreciate it. Glad to be here, and hope we can spread some good information to all our patients.
So let's talk about treatment. There's a wide range of treatment, right?
Yep.
From lifestyle modifications, diet restrictions, weight control. Sort of run us through sort of the non-medical, the non-pill,
Yes.
non-pharmaceutical treatment.
Yes.
And then let's go into some of the sort of medications that we use for reflux. So take us through that, Dr. Parikh.
I agree with you. I think it's incredibly important. You know, pills can be tremendously beneficial, but all have side effects, and we should do everything possible in our power to try to maximize getting off medication if we can. So lifestyle modification is probably the most important thing we can do. This includes dietary changes that may be difficult but important, and really important for good health and affects your other health, cardiac and stroke prevention, is weight loss. Central obesity is a risk. So, you know, focusing our diet and exercise routines to have good weight loss if we are morbidly obese or obese is really important. While weight loss means caloric reduction and exercise, increasing your metabolism, there are also certain foods that just set off people's reflux.
Right.
And I think that is also important. While you may lose weight, you still may have reflux and GERD and symptoms despite that.
Yeah, so let me tell you what works for me. Well, let me ask you this. So which side, I get asked this question, and I don't know if there is an answer. There's a textbook answer. Which side should we sleep on if we have reflux? Do you know that answer?
Yeah, I mean, if you have reflux, you know, I guess our safety position is the left side.
Left side, that's right.
That's
so
what we recommend, but...
So Dr. Parikh, why is my reflux worse when I lie on my left side?
Really?
Yes,
I don't.
It's so weird. I don't know. So while I think that generally if you're thinking about which side to sleep on, probably more important is sleeping with your head elevated. Mm-hmm. That's really going to decrease your acid exposure time more than most other things you can do.
Gravity is your friend.
In terms of that, gravity is your friend. So starting on your left side seems appropriate, but it doesn't work for everybody, including me. And so the other key trigger for me is eating late at night, which some people are kind of immune to that. They can just sort of go to town on an Italian meal like 30 minutes before bed, but I'm real sensitive to chocolate and larger meals within a couple of hours of bedtime. So that's kind of a thing for me. but I think to your point, it has to be individualized, and so I think that's where the history and talking to patients about what are your triggers and how can we sort of address your triggers as part of your treatment plan. So anything else you can think of?
Yeah, there's a few others. Those are definitely the big ones. Large meals and eating late and laying down. That's just everyone's going to get reflux. But I've had a few patients that had excessive amount of peppermints. It's impressive how much relaxation of your muscles that will cause reflux. Spicy foods we've talked about.
Did you mention caffeine and alcohol?
Yeah, I think
okay, you did.
Those are big
You mentioned
ones.
those. Okay.
Caffeine and alcohol, without a doubt. Well, it's all about moderation.
Yeah.
I'm not telling you to avoid all of this, but to minimize use and to plan for it if you have bad reflux.
Yeah, there are several ways to elevate the head of your bed at night. You can actually. The expensive route is to buy a bed that actually where you can elevate the head of the bed. That's your expensive route. You can buy bed wedges online or retail stores, or if you're kind of handy and want to try to elevate your bed frame with wood planks or bricks, that's another option. So there are kind of ways to be creative about that, but I think the point about weight control and diet is probably underemphasized. So let's pivot now to, let's say we have a patient, they've done all the right things. They're avoiding triggers, they've cut out the coffee, they're limiting wine significantly or alcohol significantly. So we need to start talking about more aggressive treatment. So talk to us about our approach to medical therapy for these patients.
And this is the mainstay, right, of reflux and how we manage a large majority of our patients. And there's, reflux meds have kind of evolved over the years. There's things that you find over the counter, such as Tums, which is common antacid that's used. You see a lot of these histamine 2 blockers known as famotidine, ranitidine. Ranitidine recently has had some issues and has been pulled, but was a long-term medication we've been using. And these kind of block some of the receptors in your stomach lining to help reduce acid secretion. There's various liquid formulations that are available, aluminum substances or solutions which really help. And then the biggest change in managing GERD are the notorious PPIs, the proton pump inhibitors. And that really changed how well we could treat medically. All these other medications were nice and good options, but really didn't help as many people as the proton pump inhibitor or PPI has. And that's another way that acid secretion is reduced significantly within the GI tract or stomach.
Yeah, I agree. Those were game changers. And I've been practicing long enough to remember them in their infancy. When I came through as a trainee and we were just sort of getting used to using them routinely, and we began to see how effective they were at treating a lot of patients with reflux. Not everybody, but a lot of patients, and we continue to use them. Nothing better or nothing has really improved upon that medication over the last several decades. So really effective go-to medications that have changed a lot of people's lives. Now, I'm going to confess, I don't love to take medication every day.
Same here.
I'm always, so I've taken PPIs, and I'm trying, I try to find ways to limit my use and to come off of medication. So I do take my PPIs on demand. I don't take them every day. So there are different strategies. I consider PPIs very, very safe medications. If you look at the entire universe of medications that we use day in, day out. And we have a short list, right, of medicines that we use over and over again, and then we have some sort of other lists of medications that we use less commonly. But on the list of medications that I usually use, I consider it incredibly safe.
I would agree with
these
that.
medications. Yet they've gotten some negative press over the last 10 years or so. So comment, Dr. Parikh, about these medicines. What are some of the sort of associations that have emerged and how we educate patients about them?
Yeah, and a lot of this came about from kind of evidence and looking at patients who have been on it for years, or these studies that look back and observe what's going on with these patients. And some of these side effects potentially have been debunked, and some are real, and we have to talk about it with our patients. So one common one that we are very concerned about now is maybe an increased risk of infection. Acid in your stomach is there for a reason, and with that gone, you can have increased risk to certain GI tract infections. So that's one that I think we all agree with. Another big one that we see and we talk about with patients is potential impact on how you absorb food and nutrients and how it can affect your bone health. Probably a bigger issue probably in most postmenopausal women, but certainly an important thing where we're looking for signs of osteopenia or osteoporosis and how PPIs may play a role in that absorption of calcium, etc., vitamin D. So that's a big one for sure.
Exactly. I think those are important, and there's also been some links with chronic kidney disease. We've seen that. Again, a lot of the data from which these conclusions were drawn were not designed to test the effect of these medications on kidney function.
Agreed.
So when you have these types of studies and you sort of see relationships, they don't necessarily mean that there's a cause and effect relationship.
Agreed.
Right?
Agreed. And we have lots of conversations with our renal buddies, our kidney doctors, and it's definitely controversial and not solidly proven, I would say.
You have some renal buddies, huh?
A couple.
I need to get some more renal buddies.
You have buddies.
I've got
for
too
all
many
the
cardiology
organs.
buddies, and I need to get some more renal buddies.
I just hope I don't need a liver buddy ever.
That's true. We have some liver buddies. I've got some I can send you to if you need it. So PPIs, incredibly safe class of medications, but discussions need to be had with patients about benefits over risks. Benefits over risks. That's something you'll hear us talk about a lot. And the benefits are often very high, and I believe that the risks are low. However, I think we can safely say that they're generally overprescribed, and not everything that causes heartburn is reflux, particularly in patients who take these medicines and take them and take 2 and then 4 and don't have relief.
Don't get better.